Welcome back and thank you for staying with us right here in Morning at NTV. We're going to be talking about the impact of COVID-19 lockdown on sexual reproductive and maternal health services. Will that bring about a baby boom? Many people are saying if couples are living in the same room and no family planning services, yes, there might be a baby boom in the months to come. Well, it's a topic of speculation. Well, every time a disaster hits, that's the truth. Now, will we see a baby boom 9 months later, since so many couples are cooped up inside with nowhere to go? Access to family planning has also been limited because of the lockdown in that regard. So we have a panel of experts we have put together to tell us how to avoid this. In studio with me, we have Honorable Pentagon Kamusime. He's a public health expert who is the MP for Butemba County in Changwanzi and a member of Parliament's Health Committee. On Zoom, we have Ms. Zaitun Nawatadega, the Director of Programs at Health Plus Development Communications, Alensi Banela, the United Nations Population Fund's Country Representative, James Tumusime, the Gender and Youth Manager at Reproductive Health Uganda, a member of the Sexual Reproductive Health Alliance, Nagiz Shiraz, a public health consultant, and Women Deliver Young Leader, and Joseph Kasaija, a Sexual Reproductive Health and Rights Alliance. Well, let me start with you, Honorable Kamusime. You work with communities under your Pentagon Community Initiative. What are the immediate ramifications that would arise or are already evident from poor access to sexual and reproductive maternal health services?
Thank you, presenter. Good morning, viewers. As I've been told, my name is Kamusime Pentagon, and I'm a member of Butemba.
Just introduce yourself and I go back to Zaitun.
And this is actually a very important issue that we should discuss at this time. Because as soon as they announced the lockdown, definitely it meant that access to every service was limited. And our worry right now, of course, is now how do people get to the health facilities? Now that we discourage them from even moving, someone could walk on foot to access a health facility, how would they access there? Those who have been having like youth-friendly corners, now that they are discouraged, how do they access such services? So it's a matter of now seeing how best can we galvanize our efforts to probably empower maybe house-to-house supply, or in one way or another to make it simple and easy, of course private, for the people to access those services. Because generally in our culture, it's not easy to disclose a need for such a service, especially within the young people. So it's a challenge.
Okay, let me bring in Ms. Zaitun Nawatadega. She is the Director of Programs at Health Plus Development. A very good morning, Ms. Zaitun. You're live on Morning at NTV.
Yeah. Good morning, everyone.
Now, give us a situation analysis on what is happening on the ground, in the field.
Thank you very much. For starters, I want to say the COVID-19 pandemic is a complex emergency for the entire world and for Uganda in particular. We've seen lots of livelihoods disrupted. We've seen lots of threats to life, violence, vulnerable populations at a greater risk, violation of human rights, and also a lot of competition for resources. But I also must say in the beginning that access to sexual reproductive health services and information is a fundamental human right. Our Sustainable Development Goals number 3 says we need to have good health and well-being. We need to ensure universal access to sexual reproductive health care services, including family planning. But you realize from the time the pandemic got on board, there's a high concentration on the pandemic, right from the top offices, from the minister to the executive directors, the office of the prime minister. Everyone is concentrating on COVID-19 at the expense of services like sexual reproductive health services and family planning. You realize there's a lot around surveillance, quarantine, management, discharge at national and grassroots level. So this leaves a gap on what is going to be done around sexual reproductive health rights, services, and information. You also realize the instruments of justice are not working as expected. But also there's limited services, especially in the rural settings. There's a lot of limited services. And this is because some of the centers in the rural areas are closed. Why? Because the health workers do not have equipment. They fear to get infected. Number two, some of them are half functioning. For example, when you look at the Greater East, someone reaches at the health center at around 2 p.m. So what are they going to do? And then they just use little time, and then of course they have to go back home. The lockdown has created issues around accessibility. Women may not choose to go to the health centers or to go and receive services, first because it is far, number two, because also they fear to get infected. And when you look at some of the issues that lead to maternal death, the 3 delays, that means they could make a decision at home, but access to the health center takes long. Even when they reach the health centers, the services are not available. I also want to mention something around the disruption of the supply chain. Procurement of supplies, commodities is now delaying. If they have to procure supplies from out of the country and they're using air transport, there's a delay. If they're using water transport, there's a delay. And also, even the commodities that get here, there are disparities in the distribution of these commodities to get to the health centers. So you realize in the process, women are going to switch to short-term methods of family planning for using long-term methods, because that is what they can afford. Probably if someone was using implants, now is going to use injections because that is what is near to them. Number two, the lockdown, the measures that have been put in place to ensure we control the spread of the pandemic has created less out of pocket for people. So now they are struggling between, should I use the little money I have to access services, or should I use it for food? So they choose between a meal and SRHR services. You also realize many times we would reach out with information and services through outreaches in the communities, through schools, and now this is no more. So that has limited access to these sexual reproductive health services, including family planning, among others. Our young people have been disconnected from their social networks. And these are the points where they would get access to information, commodities, and services, and things are not working out. You also realize there's been a high increase in violence cases. You're putting, the lockdown has made people stay in one environment for quite a long time. Some of the girls, some of the women, some of the men are staying with abusers in the house every other day. And this has led to issues like increase in GBV cases. You realize also our people living with HIV are struggling to get ARVs. So some of them are missing them out, and adherence issues are coming up. Some of our girls used to get menstrual hygiene management supplies in the outreaches that organizations do, that CSO does, and now how are they managing this? So it's quite a huge emergency that is with us, but we need to do something around it and see how we can ensure, yes, the pandemic is here, but it has to be continuity of provision of the essential services, including sexual reproductive health and family planning.
Thank you very much, Ms. Zaitun Nawaterega. And I would like to bring in a public health consultant, that is Nagis Shiraz, to tell us more about how the COVID-19 pandemic has actually exacerbated low access to contraceptives. A very good morning once again, Ms. Nagis.
Good morning. Thank you very much for having me. I'd like to first start with painting a small picture on the current population statistics when it comes to adolescents. I'll specifically talk about adolescents because that's an area that's been ignored for a very long time. So 1 in every 4 Ugandans is an adolescent. That's about 23.3% of the Ugandan population. Now that's a huge population to ignore. These are between the ages of 10 to 19. So I think you can go backwards and think about what you are like between the ages of 10 to 19. Remember, this is a process when you're discovering yourself, right? The breasts have started growing for the girls. The boys, the voice is deepening, you know, and you're starting to have these strange feelings. The hips are out for the girls. The boys are finding the hips very nice to look at. So this is a point where we really need, and I stress this point, we really do need the young people to have access to education, information. And when I say education and information, I mean targeted education and information. We're talking about young people that are disabled. We're talking about young people that cannot read or write. Do these young people have access to the important and targeted information that they will be able to understand? So if a young person does not understand English, yogera mu Luganda, you know, bring in your neuro. Does our information that we give out to these young people, is it in their local languages? Can somebody that is not in the urban areas understand this information? So, you know, that is a very important thing. And then next, it's also very important for us to have access to services for young people. Right now, we are on lockdown, but let me tell you something. There is no lockdown on sex. I'm just being honest. There is no lockdown on sex. And yes, in the urban centers, we see people in their gates and everyone is locked in. But let me tell you, I live in Kitende. This is on Entebbe Road. And I'll tell you right now, even as I look out of my window, I can see people moving around. So do not think that everyone is locked up behind bars, you know, everyone is in a fence or something. No, there are young people that are moving around. Remember, they don't have much to do. So they are idle. There are those that don't live in fences. So they are moving around. You've got young people. Recently, I saw young people just outside my gate. You've got young people that are now starting to crowd at around 7, 8, you know. They are on their own in secret corners. What is going on? Are we asking ourselves the question, what is going to happen after the pandemic? Let me paint a scenario for you. There's going to be an increase in unwanted pregnancies because, believe you me, I'm a born-again Christian. I'll give an example. So I believe in abstinence, but my values may not necessarily be someone else's values. And we're talking about young people. They love to discover. They love to explore. It's a natural part of being young. So these young people are going to, you know, act on their feelings. And before you know it, you've got an increase in unwanted pregnancies. Not only that, but you'll find that you have an increase in school dropouts. Now, you might say, okay, fine. What's the relationship between sexual reproductive health and education? Let me paint another scenario for you. Did you know that a 1% increase, I'll repeat that, a 1% increase in the number of girls that gets to secondary school education will lead to a direct impact on the gross domestic product of the country? That would lead to an increase by 0.03%. If we had a 1% increase of girls moving on to secondary education. So that would also increase on the workforce. So there is power in providing enough education, information, sexual reproductive health related, and providing access to the services. It is a very, very crucial issue. So we really need to focus on that. And then the other thing I'd also like to stress is we tend to think that we know it all. We tend to think that we know everything about adolescents. Let me tell you something. We don't even have an adolescent on the panel. Let me tell you, we think we know everything about adolescents. It's so important for us to be able to hear from them because they have so much that they can teach us on who they are, what kind of services they need, why they need these services. If you could hear from an adolescent during this pandemic, you will be shocked. There are young people asking for condoms. I'm being very honest here. There are young people saying they do not have access to contraception. What am I going to do? My boyfriend is putting me on pressure. They don't even have the information to learn how to negotiate for sex in this case. This is a very serious issue and an issue that really needs to be looked into. We've got the National Adolescent Health Policy, for example, that has not been passed till today. When you look at the policy, you get to see exactly what young people need, what kind of information is necessary, what kind of services they are yearning for. We really need to think twice about what is happening during this pandemic and not only focus on just COVID per se, because yes, it is important, but we're also talking about certain issues that are so important to young people, and that is sexual reproductive health. So we need to take this very seriously. Thank you.
And how the COVID-19 pandemic has actually curtailed access to reproductive health services. I'm talking about contraceptives in Uganda. Ms. Shires, how has the COVID-19 pandemic actually exacerbated the ongoing low access to sexual reproductive health services? I'm talking about contraceptives.
Oh yeah, because now you see the whole issue with contraceptives, for example, number one, these young people do not have access to going to youth-friendly centers. I must insist on that one. The centers have to be youth-friendly. Okay, so the young people do not really feel comfortable to just walk to any hospital or walk to any health center that is open if it is not youth friendly. Why? Remember, they're easily judged. I mean, you're a 15-year-old coming to me asking for contraception. No, you know, that's normally our cultural context, our religious context. No, I'm not going to give a 15-year-old contraception. You are 19-year-old and you're coming to ask for a condom. It's impossible. Now, these young people know that. So they are naturally going to not seek, you know, some of these services. Even if there's a health center next door and you know that you can walk there, it's very difficult for a young person to actually walk there and ask, because they might walk and then they'll be reprimanded. They might go there for services and be reprimanded at the end of the day. So COVID has really crippled that access, in the sense that young people feel stigmatized to reach out and get some of these, for example, now you talked about contraception, because the youth-friendly centers are not really open per se, and then also the youth-friendly centers are not within reach. Some of them are not nearby. And remember, now we've got COVID. You have to probably walk a long distance because you can't take a border. So it's really limiting in that sense. And then also on top of it, access to information is not readily available, because there are different types of contraception, and young people need to know that they can use a method A, B, C, if it's implants or, you know, IUD. They need to be able to have access to that information to know that they can make a choice. But then that information is not there anymore. Not all young people have access to smartphones, for example. And most of the apps that are bearing information about contraception are limited to smartphones. So where are these young people getting information from? They don't have access to that information. So because they don't know, then at the end of the day, they will not reach out to receive, you know, help in terms of getting maybe contraception. So they'll end up having live sex. And also because the health centers might be a bit far from their homes, or the youth-friendly centers may not be available within their area. So that has definitely crippled access to some of these, to contraception.
I do have in studio with me Mr. Pentagon Kamusime. He's the MP Butemba constituency. We are talking about poor access to sexual, reproductive and maternal health services. Now, Mr. Kamusime, help me understand, how can technology be used to bridge the gap that we are seeing right now and extend sexual, reproductive and maternal health services to our population?
May I first to add fresh to what my colleague has talked about?
As long as you don't forget the question.
Young people who are not accessing services. There is now a challenge. All young people left school and they are home.
Indeed.
They are actually being held incommunicado in terms of sexual and reproductive health. Parents are not discussing this issue. At the end of the day, they are held at home thinking they will stay there, but those people will have to try their own best to make sure they do what they want. Because as she said, sex is not under any form of quarantine. So I think at this particular moment, parents need to come out and discuss with their children, with their adolescents, on how best they can manage such issues during this lockdown. And could you remind me of the question?
Yes, the question, how can technology be used to bridge the gap that we are seeing right now and extend services to our population?
First of all, since majority of our population don't possess those gadgets, the phone, the computer, name it, we may have to rely more on radio and television. That's what can be accessed maybe far deep in the village, like where we represent. So in this, we make sure that probably we set some programs and individuals from different areas who can go to these stations and disseminate information. But we also have our strong points, the village health teams. These teams had been almost forgotten, but they are there. This is a time to reactivate them. So we can have our VHTs, we feed them with some information concerning sexual and reproductive health, and these are the teams that can actually walk on foot to make sure that they manage issues at their village, because each village has at least 2 VHTs. I think this is a time. Otherwise, we shall use technology, we shall use anything, but to a lower person, it will not work. That is why the education that the Ministry of Health put up, that it passes through radio, TV, the people in my constituency cannot use this. So we need to yes, concentrate on the station, the radio, TV, but also reactivate the VHTs. These are the people who are going to cause an impact at the moment where people are limited in movement.
Amazing argument. Let me bring in Mr. Alain Sibanela. He's the United Nations Population Fund country representative in Uganda. Very good morning, Mr. Sibanela. Alain, thank you for joining us on Morning at NTV.
Good morning, and good morning to your viewers.
Amazing. Mr. Alain, is poor access to sexual, reproductive and maternal health services actually to blame for the unprecedented baby boom that is likely to take center stage in the months to come due to the COVID-19 containment measures?
Well, yeah, let me start by saying that this is indeed an unprecedented global health crisis that will lead to an unprecedented global economic crisis, but we also don't know, and that includes Uganda, much yet about facts and figures. So let me then start by saying that you're very right that in any crisis, humanitarian crisis, there is an increase in sexual gender-based violence, there's an increase in HIV infections, and as the other speaker said, people continue to have sex, but also childbirth does not stop. So what we're seeing now in Uganda, the only reliable figure that we have from the Ministry of Health is a very, very sharp increase from February to April, from 12 to 78 weekly maternal deaths. So that's a figure that is very important. Now, in non-COVID times, we have an unmet need for family planning, modern methods of family planning, that is 30% among married couples, which means that you have 30% of married couples that would like to have contraception, but they don't have access to. And that is exactly the issue here. The issue is non-accessibility, non-availability, and I think a bit less non-affordability. Now, with COVID, the accessibility and the availability has been totally disrupted. In non-COVID times, one of the big issues in Uganda is the dysfunctional supply chain or disruption of the supply chain. And supply chain meaning forecasting how much do you need, where, et cetera, et cetera. So right now, you know, the contraceptive prevalence rate, as we call it, which means that how much family planning do people actually use in Uganda in non-COVID times, is going now to be less, right? So that means that we have more and less and less people who actually use contraceptives. But we don't know how many, we don't know how that will now translate into an increase of fertility and births. Now, it is a speculation, but I also want to caution everyone. And I actually declined an interview exactly on this topic, where the anchor asked, well, Ugandans don't know what to do when they have free time, so they have sex. I don't want to comment on these things, and I don't think it's healthy to do that. A baby boom is a very, very strong term, and I do not know whether there will be a baby boom. I don't have a magic crystal here to say that. What is very important is that we actually go back to what can be done right now so that young people, yes, absolutely young people, but also the other parts of the population, married couples, do have access to contraceptives. And your question is an excellent one. What can we do to make use of modern technologies? And it shouldn't only be information technologies, but anything now that is innovative and creative. This is the time to do what we haven't been doing before. And I think this is important to remember. So we've started to use safe Buddha so that at least the safe Buddhas are delivering condoms into different places. We've been trying to work with KCCA to at least allow taxis to serve as ambulances for pregnant women. We have been delivering cash and fuel vouchers in our decentralized offices to district local government, to DHOs, so that they can make use of ambulances that are standing there without fuel, etc., etc. So I think we really have to push ourselves in these times to find solutions. I think this is the important point I want to make here. And I really do not know about a baby boom after 9 months.
Thank you very much, Mr. Alain. Well, he says he doesn't know that there will be a baby boom after the next in the coming months. But then you have a report, a rapid gender analysis report from the Care International and Humanity and Inclusion and Aid Organization that indicates that there will be a baby boom because couples are actually living together. Like I hinted earlier, I shall have this conversation between 3 and 5. They'll be explaining more. How does that translate to a baby boom if couples are living in the same houses and have low access to family planning? Care International and Humanity and Inclusion at 3 to 5 p.m. You're still watching Morning at NTV. Let's take another short break. We'll be right back.
You're watching Morning at NTV.
Welcome back to Morning at NTV and thank you for staying with us. Right now we are talking about poor access to sexual, reproductive and maternal health services. But then let me shed some light on that issue with Olivia Komgisha's story. She did a story on poor access on the same. Olivia Komgisha, take it away.
Uganda has struggled with access to sexual reproductive health services. It is only just enough to note that amidst the challenges in accessibility, it has taken the country a long time to achieve some success. The contraceptive prevalence rate has risen from 18% in 2006 to 35% in 2016, with a target being 50% by the end of 2020.
We had also made significant strides around the issue of unmet need for family planning. We had moved from 34 up to around 28, and we had a target by the president, which he even committed during the ICPD 25 in Nairobi, of reducing it to 10% by 2022.
However, as the pandemic rages, more women are unable to access family planning. They face unintended pregnancies and gender-based violence, among other harmful practices.
A relapse and failure to address the above may lead to a rise in maternal and newborn morbidity and mortality.
According to projections by UNFPA, more than 47 million women could lose access to contraception, leading to 7 million unintended pregnancies in the coming months.
Sadi Ngabo is living with a disability, which makes it difficult for him to access sexual reproductive health services. This, he says, is even worse during the lockdown.
So imagine you're using a wheelchair. You want to go to a clinic that is very far. So you end up, going in for something that you don't want to do.
After the lockdown was imposed on 31st March, many people could not access many essential services due to public transport restrictions. Health experts are worried about a catastrophic development if sexual reproductive health services do not become more accessible sooner.
So there's a huge gap now where we were kind of like streamlined and moving forward with sexual reproductive health. We are now slowing down and drastically. And I must add, there is a lockdown, yes, and a very much needed lockdown. But then one thing we have to realize is that sex has no lockdown.
We're actually going to have a lot of reversing if we don't integrate sexual reproductive health immediately. The issue is that right now, access to contraceptive has significantly been affected. People who need contraceptives, all the channels that are there have not been prioritizing the COVID-19 response.
A look into many of the pharmacies which were sampled around Kampala and its suburbs shows that these products and services were last sold in March. They predict a bigger problem if the matter is not handled immediately.
If this continues, there's going to be an increase in unwanted pregnancies. That is the honest truth, because young people are having sex left, right and center, and majority of them are not being protected. So that is one. Two, there'll be a lot of incest.
The woman has to seek sometimes the permission of the man to work, because men are also not now trusting their women to work on food somewhere to access health and reproductive services. So this has made decision making very, very difficult. And as such, it sometimes have increased the risk of mortality and mobility, especially in terms of women. And it's important that with me, 9 months from now, the population of East Africa will be 200 million. from 165.
How then can the situation be converted?
The area to prioritize first is to integrate sexual reproductive health messages into the COVID-19. For example, we're saying to people, stay home. But let's add that while you are staying home, make sure that you take care of your sexual reproductive health.
So I think the Ministry of Health should ensure that they provide at least condoms at the LC1 offices, because they are not far away. It's a 10 minutes walk from here, so I can access them. So I feel like if they put the condoms at the LC1 offices, everyone can access them. But then the LC1 officials should be, okay, they shouldn't be judgmental.
Dr. Joyce Moriku, the Minister for Primary Health Care, has urged couples to labor and seek access to these services.
This is not the time for the young people to get engaged into sexual activities. They're asking for condoms, they're asking for contraceptive. I'm telling them, abstain.
The country representative of United Nations Sexual and Reproductive Health Agency says they understand the urgent need of these services and are working to ensure that they are brought closer to the people.
We've started to work with Safe Border to make available different kind of contraceptives, condoms and others, so that they will be transported. It's not at the level of an app, because as you know, not everyone has access to a smartphone. And outside Kampala, we've started now to actually give fuel vouchers and cash vouchers to the district health officials and the in charge of health centers, especially Health Center 3, so that they have their vehicle that they actually have, but they don't have the fuel, so that the vehicle can go and pick mothers up, take them to the health facility, but also, again, to distribute contraceptives.
The talk is that if the situation is not handled, then a baby boom and a rise in population is expected in the near future. Olivia Komgisha, NTV News.
Thank you, Olivia Komgisha, for that piece. Poor access to sexual reproductive health services. Let me also bring in Mr. Joseph Kasaija. He's a sexual reproductive health expert and from the Rights Alliance. He's going to be telling us more about the rights of women during this lockdown. For many women and girls, being in the lockdown doesn't mean being safe. So what are the rights of women, and what measures can we employ in the interim to ensure that women's rights are actually, safeguarded? Mr. James Joseph Kasaija, thank you for joining us right here Morning at NTV. Good morning once again.
Thank you very much for hosting us. Good morning, everyone. We all understand that the rapid growth of the COVID-19 pandemic has raised global awareness of inadequacies in our public health system across, of course, the high, middle, and low-income nations. And of course, as healthcare systems are stretched to the capacity dealing with this pandemic, many of us should be worried that the delivery of essential health services, which include family planning, they're being severely compromised everywhere, both in urban and rural. And we all understand that we project over 9.5 million girls and women who may not be able to get the vital family planning services this year because of the COVID, due to both in supply and demand, will result into a lot of maternal deaths, as well as people who are going to get pregnant. What we would call the post-pandemic pregnancy rates will be high. So we have to be prepared that our health system should be able to accommodate, if at all we cannot do the prevention. But however, we still have a chance that we can do something about the prevention right now. It's why we're advocating that let there be interventions to support and facilitate access to contraceptives, access to information. We all hear people saying, our Honorable Minister was saying about abstinence. Yes, we are preaching abstinence, but even when you talk to religious leaders, they say they have tried their level best in church to preach abstinence. And we have come out to say, if it is failing, what is the way forward? Can we find a way of integrating health messages, abstinence, or using the safe contraceptives in the preaching as you're preaching, we're not telling you to go against the domain of your faith, but we'll find a way of talking to them because things are failing. Young people are getting pregnant, people are dying. There are a lot of unsafe abortions out there taking place, all because they would have been avoided if at all people got the right information and they got the right services. So we encourage at least government and all other people working in civil society that we find a way of working hand in hand, and we see how best we can work on the supply and also on the demand side. And also we can be able to monitor the shifts in women's family planning needs, preferences in light of the social and economic shocks by facing what they're facing through the pandemic.
And of course,
And
Joseph.
this also still comes to what I think one of the issues that would really help us out would be working with Ministry of Health, of course, and UNFP has been supporting this process and all other different NGOs on launching the National Adolescent Health Policy, which has long overdue. It has been there for long. It has been up and down. But however, we want to see how best we can work with people who have been opposing it mostly, the opposition that has been the religious leaders and cultural leaders. We need to bring them on table. We need to bring the guardians together and understand what is entailed in this policy. How is it going to guide on what services are going to be given to adolescents? How adolescents are going to be accessing these services and what costs that affects to the population. So the same way we want to encourage parents not to leave health education to the teachers in school. How about the people who are out of school? We need to continue developing that relationship between parents and children so that they can, if we're to spread the values of abstinence, that will really there's a tight and a good communication between the two. With that, at least we shall have a harmonious way of addressing these challenges. But the fact is, after COVID-19, there's going to be a lot of pressure on the health system, especially in the maternal wing. So we have to be well prepared. We have to find a way of government and all the actors on how we're going to address this challenge together.
Thank you very much, Joseph. Let me now bring in James Tumusime, a gender expert, to talk about these contraceptives that have been rejected, presumably because of the high costs that have been come forth as a result of the lockdown. A very good morning once again, James. Thank you for joining us on Morning at NTV. Well, contraceptives have been rejected in our society because of the presumed high costs that have come about because of the COVID-19 lockdown. What does that mean, or where does that leave us as a country?
Thank you very much. First of all, I am very glad to be on this platform this morning. And also, I am very glad to know that finally, we are beginning to look in the direction of sexual reproductive health and rights. Because from my own analysis and from everything that is happening, it is very clear that COVID-19 is a marathon. COVID-19 is not a sprint. You're not about to run through it and it's done. COVID-19 is something that is here for us to live with and for us to adapt in many different ways. Looking at your question and asking around everything that has happened, you should see that we are coming from a community where the gender space has been highly struggling for very many reasons and intent. You know, we have had a very high dropout of girls from school even before COVID, at over 33% dropping out because of reproductive health-related challenges. Now, with this period when we have had 49 days home and still counting, there is a countless number of young people, especially females, that have automatically dropped out of school. That is very, very drastic in many ways, because the people who are dropping out of school are going to end up married, because families are trading off their daughters now to survive in this COVID period. Dowry, which was perhaps high in a few months ago, is now very low. We are looking at girls surviving on sex. You've heard the president himself exclaiming several times in the Tonsembera campaign, asking our girls not to go near the truck drivers. But some of these girls may not have been traditionally sex workers. Some of these girls are actually doing survival sex. You have issues of housing. Our people, if you've seen in the food distribution, live in very limited spaces, very short distances apart. neighborhoods, etc. And there's a lot of activity happening between neighborhoods and girls, I think bearing the brunt of exchanging food for sex, etc. We've seen many things that are happening. Coming to the distribution side, we are also able to see that, of course, I think it has been highlighted by Shaz and everyone else, and especially the UNFPA country director. We have seen that a lot of attention has focused on the COVID. Not that it is necessarily an issue that there is no attention to SRH, but of course, COVID looked like it's an emergency and no one had precise information on what's about to happen. So resources are being diverted. You've seen women giving birth on the roads, etc. But in terms of, for us, in the space where I sit, we have been in the business of making contraceptives available country round, and we get our supplies from government through what is called as the alternative distribution channel. And we have sent in orders because our 18 clinics across the country in the different regions of the country remain open. But our orders have run short, especially on the things that are, I would say, fast-running commodities. We've run short on our orders on all the different injectables. We've not got the full quantities of our requests when we've requested. Implanons, which are long-term methods of family planning, have not been given to us in the right quantity we requested. And of course, emergency contraceptives, which are a very key part of a period like this one, in very short supply. So these are things that kind of portray an image that we are not, of course, ready as a country, because perhaps these are sometimes in logistics management, it's not that everything is demanded and runs out at the same time. So we did not have perhaps enough quantities. I am glad that we still have enough quantities of condoms coming through the distribution chain. But of course, the ordinary person does not live in a health facility or its equivalent location at every one time. So stores like pharmacies need to be supported. And if there would be a way that the Ministry of Health, for example, would strike a deal to make some of these contraceptives that are free in public health facilities also be readily available and have a wide distribution in the pharmacies. For example, non-branded condoms which are coming from UNFPA and the government of Uganda. These can be available in the pharmacies at free peak without necessarily having to incur the high cost of the branded luxury condoms. The injectables that are like Cyanapres, which are self-injectable, can be made available through the private distribution facilities. So the ministry could work out a way, and I imagine this can be done. There are many things that are happening from the perspective.
Indeed, many things are happening, James. And right about now, I would like to talk about sexuality education and a surge in domestic violence cases. I'm going to give each of our panelists at least a minute to talk about that. How has poor sexuality education compounded a surge in domestic violence episodes as witnessed in our societies during this lockdown? I'm going to start with you, Mr. Allen.
Sorry, I was muted.
Yes.
Well, yeah, sexuality education is very important. And as the previous person said, out of school is critically important. So sexuality education, as you know, is a sensitive topic in Uganda. What we're seeing is that the curriculum development is still too slow, so that it's actually being rolled out. But you see, one also has to acknowledge that the Archbishop the other day spoke out about, you know, don't forget your contraceptives. And I think these are signs that there is an increased awareness about the importance of knowing about the different aspects of sexuality, and including different aspects of SRHR. So it's critically important. And it's important that the Ministry of Education continues work on rolling out the National Sexuality Education Framework.
Let me also bring in Nabaterega to let us in on what she has to say on that.
Thank you very much.
Yes.
When it gets to the issues of sexuality education, I think we need to go back to our traditional responsibilities as parents, because the parents are the first source of information. The parents are the first person our children, our adolescents, our young people believe in. So I think this is a time when we don't need to put our hands down as parents. We need to do our work, talk about staying safe, talk about how to keep healthy. And I know it's a little bit of a challenge to the parents because some parents don't even know how to start talking about these things. But this is a time when we have to do whatever it has to whatever it takes to ensure we talk to our children about sexuality education. But I also still believe there are other channels. The Ministry of Education has done an amazing job for teaching. I see a lot of lessons in science, mathematics, whatever it is on TV. But I think they should also have sessions around sexuality education, age-appropriate education on TV, on radio, on community radio, to ensure this information trickles down to the young person wherever they are. So I believe we can still use the traditional channels as we keep in mind the elements of social distancing, ensuring we do work around stop of the pandemic, but also ensure our young people, wherever they are, they get this information. Because we used to get them in the schools. We used to do community outreaches, which are not there anymore. So
okay, Zaitun, thank you very much for that perspective. Let me also bring in Mr. Joseph. Mr. Joseph, do you think it's because of poor sexuality education that we are seeing a surge in domestic violence cases in Uganda? And what lessons can be drawn from this COVID-19 pandemic to avoid future disruptions?
I do believe there is a lot of increased domestic violence happening right now, and it's very evident in our communities because, you know, people are not used to staying together, and the longer people stay together, the more they clash, the more people are getting fatigued because they're not getting money. And so there's a lot of stress at home, also children at home, so there's still a burden on the family. So you find couples having a lot of challenges and arguments, and a lot of gender-based violence taking place. And most times it's happening inside doors, and people don't get to know how to save them. But also we have to not forget about the people with disabilities. The people with disabilities are being affected mostly in this COVID. They have not so much been reached out and been supported so much, especially in our health education. And I believe if at all we have we address these issues, the issue of gender-based violence can be worked on, and also we continue supporting whenever we give out messages on COVID-19. Let's find a way of integrating SRHR information or health information on how people can stay, can abstain, can use the right contraceptives.
Well, thank you very much. Thank you very much, Mr. Joseph Kasaija, for that input. I also thank you all, Elaine, Zaitun, Mr. James right there. We also had Nagis Shiraz. Thank you very much for having made the time to speak to NTV. Now, in studio, I still have Mr. Pentagon, Kansime. He's the MP, Butemba constituency. Now, we are still talking about SRH, sexual reproductive health services in Uganda and the poor access there is. Now, what should be done to prevent yet another challenge from this health sphere as we progress to overcome this problem?
Let me beg to submit slightly on domestic violence vis-a-vis the pandemic. There are 3 key areas I'm identifying. You know, the Bible says there is a reason for everything. God could have brought this pandemic to check our life. 1, families have not been having time to understand each other. They got married, they've been absorbed in work, always busy, and that's why sometimes husbands delay coming home. They want to avoid a few things. So with that kind of hide and seek, delay somewhere, come late, sleep and run away, people had not had an opportunity to understand each other. So by sitting together now, someone will start to identify some characters that he had not seen in somebody. Why do we live together harmoniously? We have understood each other. So that's one thing. Secondly, there are unresolved differences that have always happened in families. But because of the busy schedule and other competing demands at home, we have not solved them. But now that we are seeing each other daily, they must be resolved, which end up in a quarrel.
But Mr. Pentagon, we've had this conversation for over an hour and a half, and we haven't talked about the role of the government.
We are coming.
Why is this matter being ignored by the government?
Can I finalize this?
Yes,
the
but
sad thing is poverty.
Poverty.
Once there are too many demands, but the breadwinners of the families don't see tomorrow, they don't know how it will be, they definitely get stressed. And what does stress lead us into? Fights. So what does the government have to do? Right now, we must appreciate that the problem is here, and it is actually coming to check our economic plans, our behaviors, and our lifestyle. So the government needs now to come up rapidly and see how best we can survive this, but also protect our population and roll them to the future. One, can I also submit that we can benefit from the available technologies? I remember there were partners that had given phones to village health teams. You know, I like them because they are within the people. They don't need transport, they don't need border. If we can now reactivate such a network, this person at the village can be a contact between the villagers and the health center, the nearby health center.
You're talking about an app, a community app.
It can be an app, it can be some messaging system where someone can report to a VHT and say, look, I need this service. And someone, now the VHT who knows the channel can communicate to the nearby health center and such a service is served at home. But also, one of the panelists talked about the policy, the sexual productive policy. I think the Minister of Health has to come out right now and rectify this, because this is a time now to look into our plans. How best can make sure that even the next pandemic shall not take us by surprise. Then there's an issue that should actually worry us so much. It's not about the baby boom. Africa is not short of food. Neither are we short of land where our people can stay. The biggest challenge is that people are going to get diseases during this time. I want to tell you, from 2003, I've been practicing medicine. And people believe in me. I have received so many calls and messages from my people asking me on what to do, how to get services. I want to tell you, people have been aborting. Either by accident or intentionally, and they have been getting post-abortion care. Where are those cases going? Do you know that Uganda loses over about 20 women a day in those delivery and labor-related issues? So what does it mean? And you know, with Corona, we have been with it, but we have not lost any. Thank God. I think that at this particular moment that we have managed to manage COVID transmission within the country, we need now to channel some efforts to managing those salient issues that are causing death and infirmity. So the government has to come out rapidly and empower our roots from the health center.
Pentagon,
why don't we see a parish chief at this time heading a team that can mobilize a parish to make sure that we look at every aspect of livelihood?
We have less
and
than a
health
minute,
care.
Mr. Kamusime. In like 40 seconds, can you tell us what lessons we've drawn from this situation?
First of all, that we must keep prepared. People were just living lousy, can I say, I'm sorry to say. They were just living as though tomorrow is guaranteed. But right now, we have seen that we must see far. I have a former teacher who is now a bishop, Bishop Nathan Imsibwe. He used to tell us in Barra School, see far. We must look beyond our daily food. We must look beyond staying in town. Some people had ignored villages. I must tell you, we have to prepare beyond what we think.
Preparedness is key if we are to avert the next future pandemic. Wise words from the MP for Butemba, Mr. Kamusime. Pentagon, and the conversation has been centered around poor access to sexual, reproductive and maternal health services. We are now going to go straight to Chisenyi, where Stephen Bide is standing by to talk to Sister Elizabeth right there. But as for me, we'll meet at lunchtime for more news updates. Have yourselves a blessed day. Let me leave you with this conversation.
Yes, good morning, Romeo Busiku. This is Chisenyi Health Center 4. It's under the Kampala Capital City Authority. Stephen Mbide on Fefe Swechbuga right here on the ground. Going to be speaking to Sister Elizabeth. Elizabeth is a senior nursing officer who is also the in charge of this health facility that is under cases. Good morning, sister.
Good morning, sir.
How are you today?
I'm quite well, thank you.
Sister, sorry for the abrupt, I came here just abruptly, I got you out of office just because we've been having a conversation about sexual and reproductive health here in Uganda. And I know this is a facility that also offers such services, especially to the young people. In your findings dealing with the young people and many clients who come here, are you able to understand that these people are knowing much more about sexual and reproductive health, especially the young people? Because in Uganda we call it muvubuka gunjuse.
Thank you very much. Actually, we have muvubuka gunjuse in this Chisenyi Health Center 4. We look at young people from 10 to 24 years. We have a special clinic for them under sexual and reproductive health. before the COVID came to this country, the clinic was running 6 days a week, and on average you would get about 100 young people, both girls and boys, attending this clinic.
But when you're finding, do you see that these 100 people or young people you get, are they really aware, are they aware about such issues that are crucial as they grow up?
Yes, some of them are already aware through peer-to-peer influence. Others are completely not aware. So as they come in, we put them in groups, talk to them, and find out the myth they have about sexual reproductive health, and then we give them the right information about sexual and reproductive health.
Talking about the myths, because many of these they get from their peers and other traditionalists and aunties. What are some of these, and how dangerous is it when they come to the professionals with their background of myths they are growing up with?
Okay, among the myths they have, especially from adults who are singers, they are told that when they have girls, their first menstrual period, they are supposed to give that pad to their mother, and the mother keeps it for them. This is a way of family planning. It's not until the mother is aware that this child is now ready to have children, that's when, I don't know what they do with the pad, but I understand there's something they do, then they release the pad and the child can get pregnant. Actually, this is totally not true. For as long as a girl has reached puberty and gets sexual contact, direct sexual contact, without using any family planning method, without using a condom, definitely the girl can get pregnant at whatever age. Yes.
Going back to schools, yes, I know the young people are now on short holiday just because of this COVID situation. But in schools, we used to have the senior women or senior women and the dormitory wardens who were supposed to at least do some of this counseling and guidance for the young people, the students. When you see that now many of them are in a lockdown, some of them cannot even access transport, is this a challenge for you who are dealing with this health service and supposed to give these young people these services? They are not in school where they will find the teachers and counselors and not even able to come to you. Is this a big challenge for you as we deal with the COVID-19 lockdown?
Okay. It's a challenge in one way, but also it's not a challenge because right now our clinic is segregated into meeting young people with their sexual reproductive health issues. We have also started some outreaches door to door, which are ongoing. This week, we've been around the Kamocha area, and we expect to continue with these services in also the other parishes of Kampala Central Division. So we have been able to reach so many young people and also those coming to the facility. I want also to say that we've received very, very important information from them. Some of them are being dragged by their relatives to come and test for pregnancy, but we really find that they are not pregnant. We're empowering them with all the necessary information, and those who are ready to take up some family planning methods, we do take them through the family planning methods. Those who are able to abstain, they will continue abstaining.
Okay, Sister Elizabeth, as we wind up this conversation, I just want you to speak to the young people, the teenagers who are there watching NTV right now, the importance of sexual and reproductive health, especially when we see young people, the teenagers getting unwanted pregnancies, others going for abortion, and others contracting serious STIs and HIV/AIDS. Why is it important to go for such services as we wind up?
We encourage young people to come to our facilities, KCCA health centers, wherever they are. We have at least a youth corner where they are attended to, and we have professionals, especially midwives, who are able to deal with them. They give them knowledge about family planning, about abortion care, about post-abortion care, about unwanted pregnancies. They also talk to those ones who are already pregnant. We have specialized clinics. In Chisenyi, it is on Tuesday when we only see adolescents, young people, young girls who are pregnant. We take them through a lot of, we give them a lot of information. We encourage them to attend antenatal care at least 4 to 8 times during pregnancy. We also encourage them to come and deliver from the facility. Those who are not able to deliver normally, we have a theater that can handle them through their delivery process. We encourage them to come back after 6 days when they have given birth. And also we encourage them to come back after 6 weeks to check for both mother and baby to see how they are progressing. And at 6 weeks, we encourage them to take up family planning methods. Please come to our facilities. We offer youth-friendly services. We do not judge any youth. We do not make any judgments. We take you as an individual.
Okay.
And please be open to us.
Please be open to the health professions. That is a key word I've also picked from Sister Egesa Elizabeth. She's a senior nursing officer and she's the in charge of this Chisenyi Health Center for here in the Central Division of Kampala. Thank you so much, sister. And this is Morning at NTV. Thank you so much for waking up on Morning at NTV. From 6:30, we're live on your screens and online, as well as wherever you're watching us from. Big thank you to you, those who are abroad and those who are in Uganda. This is Morning at NTV. Stephen Mbide. I was with Romeo Busik, who was in studio, and me on the ground here on Morning at NTV. We thank you so much, especially you who spare your time to watch this station, NTV, that turns on your world. I'm going to take you back to studio for BBC Daily for now, and then at 9 a.m. Mwase Mutia will be coming on with Farida Nakazwe, and be sure that at 1, Romeo Busiko will be back with NTV at 1, and then NTV at Kaungezi at 7 p.m. and NTV tonight at 9 p.m. This is NTV. Thank you, the crew, and Jeff Tracy, whom I've been with here on ground. Back to you in the studios for